Awesome. Thank you everyone for coming today. We are super excited to have Brainwave Neuroperformance Center tell us about the work that they do and how exactly it works. So we have Chloe here today to talk to us about it. Chloe, I'll let you take it away.
Awesome. Thank you. Yes, I'm Chloe. I am a office manager and neurotechnician here at Brainwave Neuroperformance Center. And we have been open here in Tucson for a little over a year now. We opened in the fall of 2022. And we're based off of other clinics across America. You may have heard of them before, maybe not. Brain Treatment Center, Wave Neuro, those are some of our affiliations. So we're a new company here in Tucson, not necessarily new in the United States. And I'm excited to share with you guys more about what we do here for children with autism, as well as adults and other children with additional conditions. So excited to kind of dive into it here. Okay, so starting out with our business owner, his name's Greg Andrews. He is our owner and managing director. He's a retired U.S. Navy SEAL with 20 years of service and over 14 combat deployments. He obviously had, very intense experience throughout his time in the service, multiple traumatic brain injuries, witnessed and was involved in explosions, those sorts of things. So he discovered MERT treatment himself after having years of struggling with mental health problems such as anxiety, depression, trouble sleeping, headaches, and issues from those potential brain injuries. So Greg actually received treatment himself at a clinic, different part of the United States, and saw amazing results. And while he was there in the clinic, he witnessed others also having amazing results, including a lot of children that they were bringing in with autism. And for him, it was amazing to see people coming in there different than they were leaving. They were leaving much better off and feeling better communication, more awareness, things like that. And so he really wanted to bring that to Tucson out here and provide that for other people. Okay, so diving into what we do here, our therapy is called MERT, that's magnetic e-resonance therapy. And essentially what it is a form of magnetic stimulation. So I will talk a little bit about what the actual process is as well, but our overview, we serve clients 3 and older with a variety of neurological and psychological symptoms. So depression, anxiety, PTSD, ADHD, autism, cognitive decline, and then even just optimization for people who are just feeling some brain fog, things like long COVID, etc. So we do see a variety of clinics here, a variety of ages, and just some statistics here. Some of these you may know, but a lot of these mental health disorders, as well as neurological symptoms, are becoming more common in the United States, and it's definitely something we want to tackle and help improve these symptoms so that people have a better quality of life. Okay, so these stats here are a little bit old, a few months old. We've now seen closer to 35 clients here. At the moment, we can only see about up to 10 clients per 6-week interval. And in the beginning, it took some time to get the word out there, but since then we've definitely had a steady stream of people coming in here, some good referrals. In terms of our success rate, that's something we're very proud of here. So about 88% of clients experience some improvement in their symptoms as stated in terms of the goals that they're looking to improve. So that is for all of our patients, including adults as well as children. And then in terms of children specifically with ASD, about 83% reported improvement in their symptoms or the goals that they were looking to improve throughout treatment. And then in terms of, hard paper facts, about 50% of clients see at least 10% improvement in the CARS score. So if you're not familiar with the CARS, it's the childhood autism rating scale for autism, and kind of gives you a sense of where the child is on the spectrum. It doesn't have everything included. There are definitely some things that should be added on there, and there are probably some
I just kind of wanted to see who they are and if that will be it.
Sorry about that. But yeah, basically 50% see at least 10% improvement in those scores. Most of the clients that we do see that have those improvements are greater than 50% improvement in those scores, but there are a few outliers there as well. So yeah, so there is some improvement even in paper and what we can see over time with the treatment. So what makes us unique compared to other therapies? Well, first of all, in terms of autism specifically, there are not a lot of therapies out there. I know there are other things that clients have tried, such as neurofeedback. That's a pretty common one. The hyperbaric oxygen therapy, and then there are ones that can be used concurrently with our treatment, like speech therapy, occupational therapy, ABA. But MERT is unique because it is guided, evidence-based with actual brain scans. So we start our treatment out with a EEG. The EEG basically records the brain's electrical activity, and we just use a cap that goes over the head to record that. We record for about 10 minutes total. And what that will tell us is what the child's brain waves currently look like at different parts of the brain. And the goal of that is to be able to visualize where in the brain there is maybe some inconsistency. So there are certain areas of the brain that are associated with more slowness. You know, usually we have more activity in the back than the front for some children with autism. And in those cases, we would be able to use our treatment to kind of bring some of that activity forward and get some more activity in the frontal lobe that helps us process things like emotion, understand the world around us. So that is how we start out with that EEG. Again, it's medication free, so very minimal side effects, which I'll also get into. Customized individual treatment plans. So based on those EEGs, we're able to come up with a specific protocol for each patient. And that protocol can change across the course of treatment as we get additional EEGs throughout treatment and see if there are changes happening, if those changes are what we're looking for. And then, of course, the high success rates. So again, over 80% effective, definitely see improvement in the symptoms that that parents and their children come in here looking to improve. And just the final one, that is an off-label treatment for conditions that are not necessarily FDA approved, but are FDA cleared. So we're able to treat people that some other TMS, magnetic stimulation locations, might not be able to, just because they wouldn't be willing to treat off-label. Okay, so before I get into these patient results, I do want to just chat a little bit about the stimulation itself, kind of what that feels like, and what it does to the brain. So the magnetic stimulation uses an electromagnetic coil and basically just sends a pulse through the center of that coil. We place the coil on top of the head. Usually for children with ASD, we'll start in the back and move to the front. But sometimes the location is just the front, just the back. Does depend on the brain scan. And the treatment will last about 30 minutes each session. There are 5 sessions per week, and then we do this for several weeks, so generally 6 weeks total that we treat. And that magnetic pulse is activating neurons in the brain. So what it's doing is creating new activity, building new bridges across the brain, and getting more coherence with the with those waves that we are seeing in the EEGs. So that's what we're looking for there. So in terms of what patients actually see, the results that we see for autism spectrum disorder specifically, increased awareness of surroundings, improved language skills, improvement in concurrent therapies like speech therapy, occupational therapy, ABA, improvement with schoolwork, reduced irritability, fewer meltdowns. So a lot of the children that we see here, they do have trouble with when they get overstimulated. It's hard for them to come back down from that overstimulation, and they easily let those emotions kind of get to them. It's hard to bring their nervous system back to baseline, basically. So that's something we do see a lot of improvement in with the kids we've seen. Increased adaptation to change, more interest with playing with other children, helping others, and then improved affection and eye contact. So a few of the examples we have here from patients that we've seen. One of these is a 13-year-old teenager with autism. And before treatment, she had minimal verbalization. She was moody, as her mother would describe it, and didn't have a lot of interest with playing with other children, playing with any of her toys. She had tried medication in the past that did help sort of calm her down and prevent some of her meltdowns that she was prone to, but she had kind of lost the joy that she had had in that process. And so after treatment, she completed 6 weeks of our treatment. That's pretty standard course of treatment here. She was smiling in the office, more clarity of speech. So she was not completely nonverbal, but only would say a few words at a time. And during the course of treatment, she started kind of putting together a few more words at a time. So instead of 1 or 2 words, maybe 3 or 4 words, maybe a full sentence here or there. And that speech was much more clear. She was also playing with her siblings at home and started playing with toys again. Just seemed a lot more interested in sort of the world around her and wanted to be a kid again, essentially. And then the second example here, a 6-year-old child with autism. And this child had minimal language skills, similar. He actually was a little bit less verbal and minimal affection towards others, frequent meltdowns, and very overstimulated in public. So after treatment, again, this child also went through 6 weeks of treatment, improved communication. So he was able to put a few sentences together as well, was getting himself dressed in the morning. That was very, very major for his parents, that they didn't have to ask him to do things in the morning. He knew to do them and was able to kind of get them started on his own. He was frequently giving his parents hugs and interacting with his siblings, playing and laughing with his siblings, and then was able to handle public outings much better. So his mother described that they could start, going for a quick shopping trip and actually take him with them without it being too overstimulating for him. Or even like his sister's recital, he was able to kind of sit through and experience what was going on around him without feeling overwhelmed. So those are just a few examples of some of the kids we've seen here, but we do have quite a few more positive success stories as well. Okay, and then in terms of how we can kind of work together. So of course, we want to bring in patients who have children with ASD and help their kids feel better, have better quality of life. As we all know, with autism, it's not a matter of fixing anything. It's just a matter of everyone having the best possible outcome that they can have and living their best possible life. And we also like to partner with other facilities as best we can, other ABA therapies, associations, and just help spread the word about what we do here, and also spread the word with our clients about other therapies that are available for them. I know a lot of the parents we've seen feel like the resources are still growing and they need the community around them to kind of help send them in the right direction. So we like to partner with whoever we can to kind of bring the community together in that way. Okay, so before I get to next steps, I will answer a few frequently asked questions. So biggest one is side effects. Of course, everyone wants to know, is this safe for my child? Is this something that is worth the risk? All of that. So thankfully, our therapy is actually very safe. In terms of magnetic stimulation in general, it's actually becoming more common in the United States. So hundreds of thousands of people have had that procedure done with minimal or no side effects. Here, the most common side effect that we see is just fatigue, tiredness after treatment. We kind of like to think about the treatment like exercise for the brain. So just like when you exercise, you might feel a little bit sore after, you might feel a little bit tired. Eating things and maintaining your blood sugar, of course, helps that. And that's true for treatment as well. But that's the biggest one, just a little bit of tiredness within the first 2 weeks of treatment. Other than that, more rare side effects we see would be irritability. Sometimes we see after the first couple of weeks, so a little bit of irritable behavior as the brain kind of reorganizes behavior and children start to become more aware of their surroundings. And sometimes that means where before they didn't know how to feel about a situation, now they might not like a situation and they might be voiceful about that. But thankfully, that irritability is something that subsides when treatment is finished, so it's not a permanent side effect. And other than that, very rarely a patient will experience a mild headache that usually doesn't persist more than a day or two. And it's generally a pretty safe treatment. So, different from a lot of medications out there that can cause, GI issues, other health issues. This really just affects the brain and is able to help activate those neurons and send the brain in the right direction without causing any harm. And in terms of how to get started, next steps here. So we do have, of course, cash pay. We don't currently accept insurance for autism treatment at this time. And we also accept ESA. So this is kind of new for us within the past 4 or 5 months, but we've been able to become an approved vendor for ESA here. And so we can accept payments through the Class Wallet vendor system, as well as the card here. And also patients have had some success with reimbursement if they choose to go that route. But the process itself is getting started with an initial evaluation. So that would be the EEG. We'd start with that, get that brain map, and then the next step would be a meeting with our doctor. So that would be over kind of like this, a Zoom telehealth call. We have 2 physicians that work with us, Dr. Julie Kim and Kaylee Prouse, our nurse practitioner. Kaylee is our specialist for pediatrics, and they will meet with you, discuss the benefits and drawbacks of treatment, look over that brain scan and see if treatment would be a good fit. And then once cleared for treatment, then the patient would begin the initial 2 weeks. So again, we start out with the brain scan, we start treatment, that's 5 days a week, 30 minutes each session. And then at the end of the first 2 weeks, we're going to repeat another EEG and doctor visit to check in and see how the brain's doing, see if we're seeing the progress we want. And again, we'll usually do that for a total of about 6 weeks. Yeah, so that is kind of the gist of what we do here. And I will open it up for any questions if anyone has any.
I have a quick question. We'll see if anybody else wants to put questions in the chat or unmute themselves. So it's a 30-minute treatment, right? And what can the kids do anything while they're sitting? Because it's like a cap they put on or like wires, and then can they do anything? Because I know it'd be hard for my kids to sit still for 30 minutes or anything. So are they able to?
That's a great question. So the EEG, and I actually have a cap here to show you. The EEG is the one where we place the cap on. That one we only record. So here is the cap here, kind of what it looks like. So it just goes over the head and then around the ears. And then this wire will connect to our machine. During the EEG, that lasts about 30 minutes total with setup and everything, but we only need to record for 10 minutes. And that's the only time that the child's really kind of in a restricted position. So during those 10-minute sessions, yes, because it's a great point to make that usually the kids that we see, they don't love sitting still that long, especially what we do. We have to have their eyes closed for the 10 minutes. So it's not always easy, but what we do is kind of record in little short bursts. So we'll record for a few seconds, have their eyes closed, have their eyes open, give them a couple minutes, and then record again. So we can kind of take as long as we need to get the recording. It doesn't have to be all at once. And we definitely can work around kids that want to move around or are, a little bit scared in the beginning. no problem at all. In terms of the treatment, the 30-minute sessions, those ones, they actually just sit in the, we have just like a basic recliner chair, and their parents can also sit with them. And the magnet that we use, we kind of manually hold over the head at the times of the stimulation. So the stimulation will go off for 5 seconds at a time, and then about 35 seconds of no stimulation, 5 seconds again, it'll repeat throughout. So in the time between the stimulations, the child can be up and moving around. They don't have to be sitting still. Just for those 5-second increments that we'll just place the coil on their head and then get that done. So yes, not extremely restrictive. It can be a little bit difficult at first for the child to get used to, but we definitely can work around any situation we need to.
Awesome. All right, we have some questions in the chat. The first one has a bunch of questions in it, so I'm going to read them to you, let you answer them one at a time. How long do the treatment effects tend to last? Like, is there a relapse?
Great question. It does depend. After the 6 weeks, we generally see long-term results. So we've seen patients that have gotten treatment 5 or 6 years ago in a different treatment center and have come back and said, my child still has all of the benefits of that, and I want to come back and kind of build on it. We've had some people who, after a little while, like after a couple years, maybe they've kept the benefits of their speech, but they're having a few more meltdowns than they were at the end of treatment. And so again, we would just kind of do another boost, so to speak. We like to offer sort of like tune-up sessions where we will have someone come in for maybe once or twice a week after they've already had treatment done previously, a few years back, and then they can kind of just build on what they've already built. But we do see long-term results generally.
All right. This, I think you might have answered this. How often do you need follow-up treatments for 6 weeks? So it's kind of, what is the cash pay cost for the 6 weeks?
Sure, that's a great question. So the initial EEG and doctor consultation is $650. And then it is $2,000 per week of treatment. So that includes the 5 sessions. It also includes any of the follow-up EEGs and consultations. So we do occasionally have other specials going. We've got 20% off for any military families, first responders, or teachers. And then I know in January, we do have a special going on right now where we'll apply the cost of the initial, the $650, we'll apply that towards the first week of treatment. But that is the out-of-pocket cost right now.
Do you think access or private insurance will cover in the future?
I think there is hope for it. I don't think the immediate future, just because the research has to catch up a little bit for access to cover, for it to be considered on label. I know that our parent company, Wave Neuro, are working on some autism trials, and hopefully within the next few years, we'll be seeing some of that be approved by insurance.
Another person asked, how do you handle this process with kids who also have sensory processing challenges?
Sure. So the goal in any situation with any of our patients is to make them as comfortable as possible. So we like to make the environment as conducive for relaxation as possible. If there are certain triggers that they have, we will try our best to avoid them, try to keep noise levels down, lights dim, things like that. So every child is different. They have unique needs, and we're happy to accommodate for that at any point. But we just basically do our best to make the whole process as relaxing and calm as possible.
Another question, any cons for people with other diagnoses like ASD plus epilepsy?
Okay, so epilepsy is an interesting one. We can treat people who have history of seizures, but it does get a little bit concerning if they have frequent seizures, because we wouldn't want to create brain activity and then create a seizure. So in that case, it would be kind of a situation where they'd have to meet with our doctor and be cleared. We have just a few conditions that would prevent someone from getting treated. So depending on the severity and frequency of seizures, that would be one. Pacemakers and metal implants in the head, that would be another one, just because we're using magnets. So those are just some of the few that would make it difficult. But generally with other conditions, besides those, we're able to treat without any major issues.
Any cases where behaviors get worse instead of improving after treatment?
It's a good question as well. I don't think we've had anyone who they have gotten worse. We definitely have had one client who they went from being really not aware of their surroundings sort of at all to when they became aware, they were a little bit more irritable about the things going on around them. So for instance, they would kind of be telling their parents no, or not wanting to interact at ABA, versus before they were not doing that, and they were maybe perceived as easier, but the thing was they really didn't know what was going on around them, so they couldn't make those choices in terms of, I don't want to do this activity. So I would say no one has gotten worse, and their behavior has gotten worse, but sometimes it is a little bit of an adjustment as the brain kind of develops.
Awesome. So anybody else who had any questions? That's all the questions we had in the chat. Thank you. Awesome. Well, thank you so much for this. This was really, really useful. Just to understand it a little, anything with a brain on it is, thanks. Oh, somebody asked, is there an age limit?
Just 3 and older. So we can't see anyone under 3, but in terms of a maximum age, no, we've seen adults, as old as maybe 85. So no age limit.
Awesome. Very cool. Any other questions?
I have a question. How did you guys come to the term, or how did you come to the autism aspect of it, I guess? Like, because you said he had a lot of trauma, brain trauma and stuff from that with the war. What makes you guys want to and strive to help the autistic community in this way?
Yeah, that's a great question as well. So I know in Greg's situation, that was kind of the purpose of why he really wanted to start this business, because when he was getting his treatment done, he saw so many kids coming in and out and feeling different each day and able to communicate more each day, just as he was watching the patients around him in the waiting room, and just hearing stories from some of those patients and from the doctors at his clinic about the improvements. I believe he also has a family member, I don't remember if it's like a nephew, something like that, who is on the spectrum as well. So it is close to home in that way also. But our whole goal here is, as I mentioned before, quality of life and helping people activate kind of their brain's best potential. And I think that autism is one of those conditions where we're still learning a lot about how we can help children with autism be their best and perform their best. And we're happy, we're actually really excited to be able to provide this as a service where there are not too many services yet in that field.
Somebody else asked, have you seen any improvements with headaches, migraines, and high sensitivities?
Good question. We can treat migraines. It's a different kind of protocol. Headaches, it really does depend. But again, it's one of those situations where it'd be best to kind of get an EEG and talk with our doctor and see if it would work for you. Sometimes migraines can be a little bit further into the brain than we could treat, and sometimes they are treatable on the outer part of the brain. So yeah, there are a variety of conditions. If you guys check out our website, multiple things, even besides what I mentioned here, that we can treat. It's really pretty awesome how even treating multiple things at once. So we've seen like children who have autism and ADHD, or adults who have PTSD and also depression. And a lot of things do go hand in hand. So the treatment works to create those waves in the best way for your brain, whatever that may be. So it can target multiple things at once.
Yes. Someone's asked, just making sure on price is $2K per week for times 6 weeks, right? So
that's right.
Okay. Yeah. Awesome. Anybody else? Thank you so much, Chloe. It's always so great to learn what the options are to treat some of those. Like, of course, we're not curing, we don't want to autism, but like to be able to help with anxiety and things like that is super, super awesome to be able to have that in our pockets and see other options for when parents are struggling and kids are struggling and adults are struggling, not just parents.
Yeah, right.
But it's awesome. Thank you so very much. And if anybody needs any information, what's your website?
It's brainwavenow.com.
Awesome. Cool. Oh, somebody else, I have one more question. Do you offer any guarantees?
I wouldn't say we offer any guarantees, but I think our success rates really kind of speak for themselves, and we haven't had anyone leave here, unhappy. So
She asked, how do we know it's working?
yeah, that's a good question. I mean, usually the behavior changes are pretty obvious, and we normally see those changes within the first 2 weeks. So first of all, we see the behaviors changing at home, and then another kind of sure-proof way we see those changes is on the EEGs, the follow-up one. So we can actually see the difference in the brain, see activity that wasn't where it was before, see improvements in speeds and things like that. So there's kind of multiple ways that we can see those improvements.
Nice. Awesome.
I have one more question if you can answer it, actually. Knowing or suggesting this as like a treatment, does that help cue into what potential causes, environmental, genetic causes for, like, could be for autism, right? Because I'm kind of thinking that way, how we know it's working, saying that, well, there's more brain activity happening here. Is that kind of connected to a cause too as well, or just simply saying it's just a treatment that we know works?
I would say a little bit of both. I think that the treatment itself, is following research that's been shown that it works. The research doesn't necessarily show why it works in each person's brain, besides the fact that it's, creating those waves where we weren't seeing them at the speeds we weren't seeing them at before. So there are some things we do understand about autism in that way, like in terms of the areas of the brain that are maybe not as active as we would want. But I think the research is really still growing. I think that a treatment like this is really necessary, though, to ask those questions and to kind of create more avenues in research to find out why. Like, why is this working so well? Or why are other treatments, maybe less effective? Or what are some other treatments that we could build on from this that would help us answer those questions also?
Somebody asked if you can pay with HSA, like a health savings account.
That's a good question. We haven't had anyone try it here yet, but in theory, we should be able to, as long as it's like a standard, Visa, MasterCard that you can use. And generally, the HSA is your own fund, so we should be able to accept it here.
What? Any more questions? Awesome. Well, thank you so much, Chloe, for your time, for all your information. And we really, really appreciate it. And we'll be posting this on the internet and all the other places so everybody can access it too. when they want.
Great. Thank you guys so much.
Thank you so much. See you soon. Thank you, everyone.